As we enter our 60s, the functions of our organs, especially the cardiovascular and circulatory systems, begin to decline. And strokes don't happen randomly, they result from the accumulation of unhealthy habits over time. For individuals over 60, the risk of stroke increases significantly as the body becomes more sensitive to the negative effects of lifestyle choices. Medical research shows that strokes are a leading cause of death and disability among older adults. Unfortunately, many people underestimate the danger of seemingly harmless daily habits, which silently shorten their lifespan. Today, let's uncover five common but extremely dangerous habits that many people fall victim to, and more importantly, learn how to change them to effectively prevent strokes. Bad habit number one: staying up late. Staying up late might seem harmless, but it's a hidden risk factor for strokes, especially for middle aged and older adults. When we stay up late, our bodies don't get proper rest, causing the nervous and cardiovascular systems to work overtime, leading to chronic stress. This stress increases cortisol levels, a hormone that raises blood pressure, paving the way for strokes. Additionally, lack of sleep weakens the heart's ability to pump blood, causing poor circulation and potential blood clots that can travel to the brain, blocking blood flow and triggering strokes. To prevent this, establish a healthy sleep routine. Aim for 7 to 8 hours of sleep per night. Go to bed before 10 p.m. and avoid caffeine or electronic devices before sleeping. A good night's rest not only rejuvenates the body but also safeguards the heart and the brain. Bad habit number two: eating too much salt. According to the World Health Organization, excessive salt consumption contributes to 62% of stroke cases. Salt contains sodium, which increases blood volume by retaining water, leading to high blood pressure, a major stroke risk factor. Prolonged high blood pressure damages blood vessel walls, causing them to harden and lose elasticity, which can result in blockages, ischemic stroke, or even ruptures, hemorrhagic stroke. To mitigate this risk, limit your salt intake to less than 5 grams per day, as is recommended by the World Health Organization, and prioritize a diet rich in fresh vegetables and fruits for cardiovascular health. Bad habit number three: physical inactivity. A sedentary lifestyle is one of the most dangerous contributors to stroke. When we sit for long periods or rarely move, blood circulation slows, increasing the likelihood of blood clots. If these clots reach the brain, they can block blood flow and cause sudden strokes. Many people they mistakenly believe that excessive rest is beneficial, but also regular physical activity is essential for optimal organ function, especially the heart and blood vessels. So, to stay active, engage in 30 minutes of daily exercise such as walking or gentle aerobic activities. Avoid sitting for more than 30 to 60 minutes at a time. Stand up and move around periodically to boost circulation. Bad habit number four: alcohol and tobacco use. Consuming alcohol and smoking are two harmful habits that directly damage the cardiovascular system. Alcohol, it contains ethanol, which metabolizes into acetaldehyde, a toxic substance that inflames and destroys blood vessel cells. While alcohol, it initially dilates blood vessels, but it later causes them to constrict, which increases blood pressure. Smoking also introduces nicotine and carbon monoxide into the bloodstream, both of which raise blood pressure, and it restricts the oxygen delivery and damage blood vessel linings, leading to blood clots and blockages. Quitting alcohol and tobacco is a crucial step toward protecting your heart health and preventing strokes. Paving, in addition to that, accompanying that with a balanced diet, regular exercise, and routine checkups will help maintain stable blood pressure and healthy blood vessels. Bad habit number five: skipping regular health checkups. Many older adults they believe they don't need to visit the doctor unless they feel unwell. No, this is a dangerous misconception. Strokes it often occurs suddenly without warning signs, and underlying conditions such as high blood pressure, diabetes, or high cholesterol frequently go undetected until they become severe. So, routine health checkups can identify these risk factors early, allowing for timely intervention. So, regularly monitor key health indicators like blood pressure, blood sugar, and cholesterol levels to stay ahead of potential issues. And for those who are over 60, it is recommended to schedule a health checkup every 6 months. This simple practice can prevent many complications and ensure a longer, healthier life. Early recognition of stroke symptoms can save lives. Now, here are 5 warning signs to watch out for. 1. Numbness or weakness on one side of the body, especially in the arms, legs, or part of the face. This occurs when blood flow to the brain is interrupted, disrupting the functioning of the muscles in the affected area. 2. Difficulty speaking or a crooked mouth. This includes damage to a part of the brain which affects the nerves that control facial muscles and speech. Now, this resulted in a crooked mouth and an uneven smile or difficulty pronouncing simple word, that is distorted speech, unclear or unfinished speech, or even to complete a sentence. Number 3, dizziness and loss of balance. Dizziness and loss of balance are some of the nervous or serious symptoms, but are often confused with fatigue or change in posture. Now, this condition occurs when the brain is not getting enough blood and oxygen, and it causes a disorder in the ability to control the body. Now, the person experiencing this or the patient may feel like everything around him or her is spinning and cannot stand or walk normally. Now, if symptoms of dizziness is accompanied by nausea or loss of balance, sit or lie down to avoid falling and then get medical attention urgently. Number 4, blurred vision or sudden vision loss. Sudden vision loss is another serious sign of stroke when blood flow to the brain is interrupted. Then the optic nerves are affected. This can cause temporary loss of vision, partial or even total, and usually occur in one eye, but sometimes it can occur in both eyes. If we if we severely affected by this, then we should get try to cover one of the eye and look around to give yourself a test. And now, if one of the eye cannot see clearly or is partially covered, then you need to seek medical attention immediately. Number 5, severe headache. With a no apparent cause, a severe headache with no unknown cause can be one of the dangerous signs of a stroke. These are the most severe pains a patient has ever experienced, accompanied by dizziness, nausea, or loss of consciousness. Now, it could be due to hemorrhage in the brain when a blood vessel in the brain ruptures, creating pressure on the surrounding tissues. Now, if you experience severe headaches accompanied by symptoms such as blurred vision, dizziness, or numbness in the limbs, call immediate emergency care to have an examination. Now, if you or someone around you experience these symptoms, we cannot stop emphasize. Please seek immediate medical attention. This is crucial when dealing with a stroke. Strokes are emergencies that often strike without warning, but they can be managed and prevented with early detection and proactive lifestyle changes. By addressing these 5 habits and seeking regular health care, you can significantly lower your risk of stroke and enjoy a healthier, happier life. Thank you so much for watching this video until the end, and please make sure you subscribe to the channel and turn on your notification bell so you never miss a video when it is being uploaded. And also, if you found value in this video, please give this video a thumbs up. When you like this video, it helps out the algorithm a lot, and I appreciate each and every one of you who have subscribed to my channel. Thank you so much for your support. And until then, take good care.